In this video, we will be discussing the control of vasopressin, also known as ADH or antidiuretic hormone. There are three stimuli responsible for the release of vasopressin, with the first one being a decrease in blood pressure, low blood volume, and lastly, high blood osmolarity. The sensors responsible for detecting these different variables include baroreceptors for that decrease in blood pressure. For low blood volume, it's going to be detected by the atrial stretch receptors. And lastly, the high osmolarity, that is going to be detected by hypothalamic osmoreceptors. Afferent or input signals will be sent to the integrating center, which for all three of these stimuli will be the hypothalamus and posterior pituitary gland. So then the posterior pituitary gland will release the vasopressin or ADH as the efferent or output signal. So ADH has two target tissues, the first one being collecting duct epithelium, so really the renal collecting duct. And the second target tissue is vascular circular smooth muscle. So for the collecting duct, the target tissue response is going to be the insertion of those water pores, right? To ultimately allow for increased water reabsorption in order to conserve water. And for vascular circular smooth muscle, it is going to be vasoconstriction. So through both of these tissue response and subsequent systemic response, whether it's the insertion of the water pores that will then lead to water conservation, that will increase blood pressure, as well as vasoconstriction, which will ultimately increase blood pressure as well. So this is a kind of quick and straightforward flow chart for the control of vasopressin, also known as ADH, and really thinking about the systemic response of vasopressin can be figured out by just looking at the terms for this hormone. So for example, a quick way that I kind of remember is by looking at ADH, so antidiuretic hormone. So a diuretic or diuresis, diuresis being urination or diuretic that kind of helps you urinate. This is an antidiuretic, so it's going to essentially make you not pee, right? By inserting those water pores into the collecting duct and allowing for reabsorption of water rather than urination out. So we know right there that there'll be an increase in blood pressure because of the antidiuretic effects of this hormone. And then also look at vasopressin. So the prefix vaso relating to vasculature, and then pressin, which is Latin for literally to squeeze, which results in that response of vasoconstriction. So hopefully those little tips in looking at kind of the prefix and suffix behind these terms will help you remember that. So thanks for watching. If you enjoyed, please give me a like and subscribe.